Although I may have a medical patient in front of me who is the one who's undergoing the treatment, has been diagnosed and is overwhelmed with the process. In essence, it's them and their loved ones that are going through this together. We know that if couples or families, if there are caregivers that are not doing well psychologically, that has an impact on the patient directly. And so we really try to forge relationships with caregivers, make sure that we're not ignoring their needs, make sure that they know that they can ask for help from the patient as well, because it becomes so focused on the medical patient. Again, I think we lose sight of how we can assist the whole family unit. I think communication is key in maneuvering through the cancer experience. And again, at the helm of that is the family unit. People are usually not trained or have experience in talking to each other about cancer, about uncertainty, about the future, about fear. And most families need assistance in gaining experience in doing that better. It is important to talk about these things. We have to lean into the anxiety. We have to help people feel confident in leaning into the anxiety, and talk about things, and come out the other side with a better understanding and a better menu of items that they can pick from to say, you know what, we can get through this. Oftentimes, really the general component and working model that I tend to try and bring into my general and initial assessment with people is that we're going to see in times of stress, and cancer certainly falls into that category, an amplification or an intensification of existing dynamics and patterns that are in that family already. So if there is a tendency for some of those things to be present, we may likely see a more exaggerated form of that. So it could be, we could look at it in a couple ways. We have to look at what leads that caregiver to feel so needy and so not able to be equipped that the patient is taking care of them. But we also perhaps might help the patient to explore their strong need for feeling responsible to do that. The idea of being an advocate for somebody, a caretaker, a family member that's playing that role is extremely important. It's extremely important for the patient to have someone to rely on. And I'll expand on that in a moment, but it may also be just as important for that advocate to feel empowered and equipped to be able to play that role efficiently and effectively. It comes back down to communication, I think, of really being able to join with the patient and figure out what they need, but also to be able to say, I hear that you need that, but I can't play that role for you, but let me help you figure out how to play, who can play that role for you. So it's partly being able to form a network of support for the patient, because there's not one person who can do it all.